Food insecurity. Could you maybe describe, and just generally speaking, what that means? And then maybe can you talk about what that really looks like here in Travis County?
Yeah, absolutely. I think it's a term that is heard a lot and not often necessarily understood. Some people describe food insecurity as a family, a household, an individual not necessarily knowing where their next meal is coming from. I also like to think about it through the lens of families, individuals who are having to make really difficult choices between food and medicine, food and paying their utility bills, food and housing and rent costs. Here in Central Texas, over 500,000 people are facing food insecurity. Our food bank serves a 21 county region, and understandably, not surprisingly, the highest number of those food insecure individuals are here in Travis County. 1 in 4 children in
Okay.
our service area, and then 1 in 6 overall in the Central Texas region are facing food
Wow.
insecurity. Yeah, I think it's a variety of factors. It is not a surprise that the cost of living has skyrocketed
Yeah.
over the recent years and decades, really. You'll hear the term food desert.
Mm,
We at the food bank have started to use the term food swamp
mm,
because particularly you'll find well, I guess in both rural and urban communities, there may be food options, but the only option might be a gas station
sure.
corner store, which doesn't necessarily have the healthiest
Right. Right.
variety of
Hmm.
choices for folks. And that's really a consistent challenge across the Central Texas region is there are so many of those food swamps
Sure. Yeah.
in many communities.
Which leads to more health problems, right? Which leads to other things.
Absolutely. It's all interconnected.
Yeah, that's really interesting. So you mentioned COVID, so maybe you could talk a little bit about that. What have you seen differently doing maybe post COVID in terms of access to food?
COVID, I think, really shed a light on how many people are facing this problem. I think prior to that, even at the food bank, we didn't necessarily know where those pockets of hunger
Hmm.
existed.
Maybe can you give an example of something innovative that you've been experimenting with that will address the need better?
I think a great example actually is the partnership we formed with the Housing Authority in our Golden Harvest
Yes.
market. We have a limit in the number of
Yeah,
households we're
sure.
able to
Yeah.
serve. And so we were thinking, okay, we know these populations exist. We're using
Yeah.
this data. We
Right.
have this new
Yeah.
partnership. How can we get resources to these folks that aren't able to participate in that program? So we've launched the Golden Harvest Market
Yes, you
directly,
have.
really, as a result of our conversations with
Yeah.
you
Yeah.
and now able to provide that healthy, fresh produce
Yeah.
on site for that population where they are. Bringing the food to where the
Yes.
people are, I think, was the biggest lesson from
Sure.
COVID.
Sure.
Another new program we launched in the last couple of years is we call it the mobile pharmacy, FARMACY.
Nice.
And it's really part of our food as medicine initiatives.
Yeah.
We're bringing essentially a grocery store on wheels. We deploy it to healthcare facilities. So when folks are going to have an appointment with their physician, they can essentially get a prescription, a food prescription,
Oh,
and come
wow, yeah.
shop in the grocery
Oh, neat.
store and take
Yeah.
home healthy produce
Yeah,
with
that's
them.
awesome.
Things like that. But it's those conversations with housing, with transportation, with healthcare. It takes everyone,
Sure,
sharing
yeah.
information and reading from the same sheet of music.
Yeah, that's wonderful. For those that are listening in the audience, please, this is our call for advocacy to really be a part of the solution as we try to make our community better. Thanks again for listening and have a great day.